Hi, how are you doing? My name is Dr. Clement Liu. Welcome to Balanced Aging again. Today's topic is how do you get up if you've fallen? We know that many older adults, as you age, you start to lose balance due to many issues. Sometimes there's a visual impairment. Sometimes there is actually decrease in sensation in your feet or in legs. There are many conditions that can affect your balance. So your risk of falling usually is increased. So what do you do? So let's say I've fallen. So the first thing that you make sure is that for sure you didn't hit your head on anything. If you've hit something, if you hit your head on anything, make sure you do report it to your healthcare professional, family member, to have it looked at, to make sure there's no internal bleeding, no concussion that has developed. Second, make sure there's no bleeding, no abrasion, because that can be gone unnoticed initially, especially after a fall. Everyone's in shock. So any bleeding, any open wounds. Okay, so if there's any open wounds, that again is a sign of emergency. Call 911, try and get help as fast as you can. If it's just a minor scrape, we can deal with that later. Third, we need to look at is there any fractures, okay? Most easily fractured area when you fall is your hip, okay? So if you've fallen and you feel that you cannot move or you heard something that cracked, okay? Make sure, don't move in this position. If you have a medical alert, press your medical alert. If you have your phone on you, press 911 so that an ambulance can come and help you, okay? But if none of those things has happened, or no fractures, you can tell if there's a fracture most likely if one, there's a sharp pain and you start moving, okay. Two, there's like open wound and a bone sticking out, okay. Or you can't put any weight on that area. Okay? So if you have neither of these conditions, then we can start to think about how are we going to get ourselves up again. Okay, so first thing we need to do is trying to get yourself in a quadruped position, what we call. So what we're going to do is try to get to our side, use our hands, and slowly push off with your elbow, okay, in this position. This requires a lot of core strength, which in other videos we will explain how to train. Next, we will try and push off with our elbows, try and swing our body as one unit and come up in a quadruped position. Okay. Another thing we need to try and protect is our back. Okay. Some people, as they fall, they've also injured their back. Sometimes with the compression fracture, especially if you have osteoporosis. So if you feel any sharp pain in your back again, make sure you try and not move initially. Calm down. If you can, have someone assist you, bracing your back so they can move in one unit. Once we get ourselves in a quadruped position, we are going to crawl, okay, to any surface that we can find, okay. Let's see, we see this chair, okay. Crawl to this chair and put our left hand on, right hand on. We're going to keep our backs straight, okay. Then we're going to lift one of the legs out, okay, into a kneeling position, okay. And we're going to try and use our glute muscles here to push up along with the hands and the back leg. So we're going to push it off like this. Okay. When we get into this position, we're going to move our right foot back in. Okay. Again, as you can see, my back didn't really move too much. I've been always using my hips. So in this position, slowly come back up using your bum muscle. Okay. So in this position, you can see I've not really used a lot of my back muscles while getting up. Okay, so we're going to do that again and get back in that position. I'm going to hip hinge. So I'm going to sit back and hold both hands on the chair and get back into that position. So again, my back still hasn't moved really. I haven't kneeled. I'm going to kneel down. Again, my back hasn't really moved. I'm going to kneel back down and get back into the floor, into this quadruped position. Okay, so let's do that again. We're going to crawl back into the surface. This can be practiced actually with your loved ones, especially if you have a loved one and you have to work, and sometimes they're unattended at home. It's important to teach them what to do if they have fallen at home. So again, we're going to lift up that one leg. Again, my back hasn't really moved again. We are going to push 1, 2, 3, and push off. Okay. Once they're in this position, make sure you're stable first. Okay. You don't have to move because your hands are supporting. Okay. Then you try and bring that right leg back. Again, my lower back hasn't moved very much. And then slowly use my glutes and use a hip hinge and stand back up. Okay. And find a surface to sit on. If you do have blood pressure issues, you may find that you'll be a little dizzy. Make sure you do sit in a steady surface so you don't fall. Thank you. If you have any comments or questions, you can post it below. Thank you.